Hi, everyone. This is Matt Turner with the Office of Medicaid Development and Administration. I wanted to welcome you all today in regards to our webinar for participant-directed goods and services under the self-waiver. Myself and my cohort in crime, Rick Donnelly, will be giving you the highlights in regards to this service and going through some of the things. And then later on, we have our special guest presenters from Morning Sun to help with some of the things in regards to what they do and their responsibilities in working with this particular service, as well as some of participant-directed HBC services and those type of things. So please stay tuned. If you have questions, go ahead and you can generate those questions out for us as we move along. And then at the end of our presentation, we'll try to answer some of those. Please understand, if there's a lot of questions, we probably won't be able to get to all of them. But so we'll parking lot some of those questions at the end, and we'll try to reach out to you individually, okay? So with that being said, again, welcome, and here we go. So basically what we're going to try to do today with this webinar is we're going to answer these type of questions that often kind of get asked by us, by myself and Rick, as we're kind of the point persons for the self-waiver, myself specifically where it comes to participant-directed goods and services, or commonly what we call PDGS. So we're going to talk about what the requirements are for using this particular service. We're going to get into some of the things that people always like to know is what's actually prohibited. Then we're going to try to help you guys in regards to what are the required responsibilities for a service support administrator, as well as authorizing PDGS requests. We're going to touch base on the infamous medical necessity. And then we're going to talk about County Board's responsibilities for reviewing these PDGS requests. We're going to look at what our responsibility as an agency is for what we are required to review when a request comes in for a particular item, service through PDGS. We're going to look at what the responsibilities of the financial management service, the FMS entity is, which they're here today with us. And then what are how to avoid issues with submitting requests to the FMS. And then we're going to also touch base a little bit about employer authority and how budget authority works with this particular service and some of the other self-waiver services. So the basic fundamentals of PDGS, it's only available for those individuals that are enrolled on the self-waiver. It's a way, since basically the self-waiver doesn't have a means or a mechanism for specialized medical equipment or for a service that's specific that allows for adaptations or accessibility modifications to a home. So a lot of times PDGS is used for this. So, it's a way to fund the service, equipment, and supplies when there's no other programs or resources to meet that need. It allows items or services to be purchased from stores, companies, or other entities available to the general public. So that if they meet the service delivery requirements, that's within the scope of the actual rule. The thing that a lot of people always ask ourselves is there a laundry list of items of what's in and out? And the answer to that is it's not, because every person, just like with any of our other services, have different needs, different resources. Instead of an item that service or equipment supplies must meet the requirements that's outlined in rule. So there's not a list. You basically have to go look, and it's really going back to what that assessed need is and making that determination. So the other requirement continued is that you have to be able to meet the following things within the rule. So to kind of simplify it is that the item, the service, it has to be something that's needed for the person to stay healthy and safe. It has to be always the least costly option to address the need from an assessment. And this is regardless of funding source. So PDGS is not always the quick fix. You still have to look at other resources like Medicaid card services. And as we go along through this webinar, we're going to touch base more on that. It has to be something that helps the person directly. It's not something purchased for someone other than the person. So, what is that direct benefit for that person? And it cannot be, in the absence of the person, be able to be used by others. It's only specific to the self-waiver recipient. It's something that the person is unable to purchase for themselves. So again, when we look at adults who may live alone, they may not have the availability to be able to have the fundings or means or mechanisms to purchase this themselves through a different funding source, and so we look at PDGS. If it's a child, you have to take into consideration, what the parents responsibilities are if they have the availability to assist with purchasing that item or that something that's needed. You have to kind of go through this process to see what resources are available for that person, or if they truly are unable to purchase for themselves. It has to be something that is not available through any other resource, like the person's Ohio Medicaid state plan benefits, private insurance, local programs, or natural supports. And this kind of goes in hand in hand what we kind of consider coordination of the person's benefits. Okay, I'll try to speak up. The microphone's on the ceiling, so it's kind of weird for me here in this, we have our webinar room. So I'll try to speak up for you guys. So the other thing is that basically we have to look at, it has to decrease the person's needs for other Medicaid home and community-based services. So you can look at if it's a reduction to an existing services that they're using. You know, a lot of times when we look at this, I've seen where county boards have actually taken the time and the effort to actually show a cost analysis in regards to where the savings would be versus one service using this particular service or item through PDGS. It has to help the person to be more involved in their community or family. So if it helps them with direct integration within the community or allows better integration with their family. Again, you know, it has to be able to help the person be safer at their home. And then the other part of this is, of course, it increases or offers independence. And a lot of times when we talk about independence, sometimes what we're really talking about is the decreased need for human or dependency for human support. How does it increase that person's independence without the dependence on others? You know, it should improve the thinking, social skills, or behavioral functions. A lot of times when we look at certain items, it may have some behavioral reason or functionality of why that particular item is being used. The other part of this, it helps develop or maintain personal, social, or physical skills. So these are part of the requirements, and this is kind of like what we have to look at or try to think in our heads of how we need that particular service, item, or particular vendor that's being used to provide that service works with these type of bullets. So one of the big things that we always run into is, well, you know, Matt, Rick, what is not allowed? Is this allowed or is it not? And I think sometimes our FMS gets asked this a lot of questions, and sometimes there's the obvious, which are self-evident. So a lot of times, you know, experimental treatments are not going to be allowed. They're prohibited. Items used solely for entertainment or recreational. So things like, you know, if the item in itself is really purposed for recreational, you know, it can be used by absence of others and those type of things other than the person. Really, then you probably shouldn't be taking it into consideration as something that can be purchased through participant-directed goods and services. You know, going back about experimental treatments, which this bullet and the bullet that talks about the U.S. Food and Drug Administration as experimental. So a lot of times we know that specifically with our autism population, sometimes there's all these new things and innovative things that are out there. And like, you know, we saw this, we want to see if it can be done. You know, but the onus is, or the responsibility sometimes what a county board has to look at is this really something that is not experimental, or for the fact that it's investigational? And a lot of people will go, well, Matt, how do we do that? Well, sometimes you have to actually go to the website, look it up on the Food and Drug Administration to see if it's something that is not experimental or investigational. A lot of times you may want to look or ask for credible medical journals in regards to what the item is. And what we mean by that credible medical journals is, it's not something that the vendor has done a self-study on themselves. It is done by an outside source other than them in regards to what that is. You know, a lot of the big things that came up was, we'll say, I lost my thought in regards to what it was, Rick.
The bionic suit.
There was like a bionic suit one time that was out there to assist with you know, spasticity in regards to CP and those type of things, but it was more, it could not have been validated. It was more investigational and experimental, and there wasn't any outside kind of medical journals or studies that were provided. You know, the obvious kind of things, obviously we're not going to allow tobacco products or alcohol or illegal items. One of the big things too is that duplicate items that are things the person already has available to them. A lot of times I've seen where, you know, they have an iPad, an iPod, an iPhone, an iWatch, a laptop. So some of these items are duplicative in nature. So if some of these items are already there and available to them, there will not be an expectation that you would try to allow PDGS to purchase an item that already has that same scope of function or could produce that outcome of what the team is trying to do for them. Home modifications that are of general utility and not related to a necessity disability specific. So this is actually added to the rule because it kind of goes into line right now with our other rules in regards to environmental accessibility adaptations. There's no expectation that PDGS will allow for a vendor come in to increase square footage or things that would be obvious the responsibility of a homeowner. Central air conditioning, carpeting, things that would go outside the scope of what that project is, that would be the responsibility of a homeowner. So to the repair or replacement of items that were previously approved but have been damaged as a result of abuse, misuse, or negligence. So a lot of this had come up, and I'll give the example is you know, Johnny may have some challenges with property destruction or and a lot of times there's issues and concerns about, you know, it's not being washed or what happened to it or something was misused and abused and it was damaged. There would not be the expectation that really PDGS would continue to repair or replace those type of items. And then specialized services or services designed specifically for people with disabilities that would typically be offered by certified providers. And as we go through this, we're going to see additional examples of what this is. The one that really comes up a lot of times is the fact that we have all of these specialized camps out there. One of the programs that I can speak off the top of my head as a vendor is it's a specialized program for individuals with autism that allows them to play baseball. But that option is not offered to people non-disabled. So really they specialize in only serving people with autism. So when we have those type of situations or those vendors, they really actually should be looking at being certified by DODD. And so if it meets, you know, if there's a question, as always, if you don't know if it's a specialized service and you want us to review it, you can always reach out to us and we can look at it to make a determination if it would truly be a specialized service. So in looking at this, we're kind of thinking about what is the SSA's responsibility. Prior to authorizing any PDGS, item, service, or equipment, you know, and what that is within the person's ISP, submitting a request for processing to the MSS. These things have to be done first and foremost. So items, services, equipment, or supplies meet the requirements for PDGS, what we went through those long bullets on slides 4 and 5. There has to be a person-centered assessment of the person. It's been conducted and supports the medical necessity of the item, service, equipment, or supplies that's being requested. And then documentation on hand that demonstrates that there are no other payer sources is available to fund the request. A lot of times what we've seen now moving forward is a lot of county boards have created their own internal review processes to ensure that they meet what's within the service scope definition of PDGS, as well as meeting what's within the service scope for medical necessity. So the planning and the assessment piece of it. So, you know, it should be a part of service planning. You know, it should be a part of the conversation when you're having conversations about self-waiver services and there's no other resources available. So assessment. During an assessment, the SSA should talk about what the person does during a typical day to identify areas in which the person has a need. SSAs need to probe questions such as what is working or not working with their current services, what has changed, or what are the risks of health and safety that where maybe a particular item or service could meet that health and safety need. These kind of start those questions, and it really should be less about what they want or what they've seen that's out there, but really what's based on what's been assessed through a need, for that need. So, again, we kind of talked about this a little bit in the previous slide, coordination of benefits and resources. So once you figure out the results of your assessment, what the need is, then you, the SSA and the person, need to plan the services in the individual service plan. So you should, again, you're looking at conversations about all resources available to meet the needs. Identify an assessment. Use to develop a desired outcome for their services. So what you need to do is when you're coordinating the available resources, you got to look at unpaid supports, like family, friends, or neighbors. Look at technology that can make things easier at home or work, because what's also been added in just as recently, and we'll talk about as well, is assistive technology. And it is a waiver service that some of these things can be met through that service in lieu of using PDGS. Services available through private insurance or high Medicaid state plans. So a lot of times we see some things through PDGS, non-traditional type therapies can be supported through PDGS, such as hydrotherapy, aquatic therapy, equestrian therapy. I know in some particular cases, private insurance will cover hydrotherapy. So it's good to always look and ask those questions that if that individual, if they have private insurance, they submitted it. If they have a Medicaid card service, that you're looking at what's offered to them and afforded through their card service. Local services, if something's being funded locally through the county board or other community resources, is there availability to maintain that current level of funding to support them? Waiver services afforded to the person through their waiver enrollment. So a lot of times, some of the existing services that they want through PDGS are already afforded to them through that array of menu or benefit of those services already existing within their benefit plan for self. So, when we're looking at the conversations we're having, things that people have to remember when they're doing this or having these conversations with the individual or the guardian, those parents, is looking at alternative resources. Payer sources must be explored first. And I can't stress that enough, because if something comes to us and we have to review it, those are the questions we're going to ask. And we're going to ask you to be able to demonstrate that. It's before waiver funding should even be considered. You have to weigh all these other alternative resources. So when we look at Ohio Medicaid state plan benefits, especially for something that is specialized equipment or something you don't even think may be, it needs to be submitted, or the durable medical equipment supply list must be checked to see if it can be supported through their card service. So sometimes with this, of course, if you're going to look at this, it does require that there is a durable medical equipment provider, and often at times, and it is a must, you have to submit a certification of medical necessity from a practitioner, a clinician, an OT, a PT, a doctor, how it supports that need for that particular piece of equipment. And here's the thing of it is a lot of times, if you've had experience with Medicaid providers or DME providers, we're not just seeking a denial. We're actually looking or striving for it to be approved through their card services. So a lot of times what we've learned in the past is that with some particular vendors, that they'll submit just to get a denial, and they don't submit all the necessary documentation. So it's incomplete due to insufficient information that was submitted because they didn't get the appropriate clinical documentation that they requested. And a lot of times you have to work to do that. So depending on what that reason or rationale is for a denial, DODD does have the option to support the outcome of that decision of why it was denied, especially if it doesn't meet medical necessity. So we're looking for an approval. We're looking for, if it was denied, are you looking at going through the hearing rights to appeal that denial through Medicaid? The other thing that people don't often miss is persons aged 20 or younger should have any item or equipment submitted, regardless of what it is, to the Department of Medicaid, because they conduct substantiated reviews of medical necessity for all children under the age of 21, in accordance with Ohio's Early Periodic Screening Diagnostic Treatment, or EPSDT. Health check is what a lot of people call it. But a lot of people don't think that you can submit health equipment or those type of things through EPSDT. But here's the thing. So I know that I've worked with some county boards in regards to something as simple as an iPad. And people said, well, an iPad can't be submitted. It's likely it wouldn't be supported through their card service. But in fact, it can be. If it is specific to a communication device and it's submitted, that often at times, more than less, it will be approved. And it does take time to do this, but in the end, there's a payoff to it because it will be approved.
Okay, I just want to check something real quick. Several people have noted throughout the course of the broadcast that they're having difficulty hearing Matthew. I just need a couple of people to check because I want to make certain if this is isolated to a couple of the participants or it's more widespread. So if people could just, once again, just real quickly, let us know if you're hearing okay. Okay, so just for the benefit of some of those folks who've identified that there are some problems, it must be isolated because most of the folks are able to hear without difficulty. So we're not really certain what may be going on with your connection to the webinar broadcast that's affecting your audio. Unfortunately, there isn't going to be anything that we can do if the majority of people, and I just had about 25 people respond that they're able to hear okay.
Okay.
So all I can do is just let you know that hopefully the connection will be better. You can log out and come back in. If that assists, sometimes that will help with your connection. I don't know what else to recommend. And just real quickly, a lot of folks have been asking whether or not the PowerPoint will be available afterwards. And what we're going to do is look at having, for everybody who registered for the webinar, sending a copy of the PowerPoint that was used today that will not only include the material that Matt Turner put together, but also Morning Sun put together as part of today's webinar broadcast. So again, I'm sorry for those folks who are having some difficulty with the audio. Not certain really what it is, but it's isolated. I've only seen a couple of people based on just everybody who's responded.
Okay. All right, so I'll try to speak louder again, and so please, if you can't hear me, please reach out, and I'll try to speak as loud as I can without yelling. But so where we were at was with EPSDT. And the thing of it is, if somebody is under the age of 21, regardless of what the equipment is, and regardless if you think it's not going to be supported, it needs to be submitted. If it's not on the supply list, there is a code that's not otherwise specified. It can be submitted to be reviewed by basically a kids team to see if it can be supported. So that has to kind of happen. That has to be involved. That has to be a part of your coordination of benefits and a part of your service planning piece. Waiver services, all waiver services, one of the focuses is not to it's to supplement existing supports and not to replace. And you may hear this a lot of times. So it's not to, we're not going to replace the parents. We're going to support the parents. We're going to, we're not going to, we want to supplant or support already existing resources or non-funded waiver resources. And again, the availability of existing waiver services through the person's waiver benefit. I know a lot of times we get questions specific about ABA therapy, so a lot of the difficulty with this is that we do have within the waiver benefit what's called clinical therapeutic intervention, which is technically within the scope of ABA. So the thing of it is even though, you do your provider search, you search for a CTI provider, and you can't find a CTI provider, you can't go and say, can we use PDGS? Because what happens is that ABA is specific to our population. So then it makes it a specialized service, and then it is still prohibited. So it is important that you want to tap into those existing waiver benefits that's afforded to the individual, and looking at them first and foremost before we just kind of hop on the PDGS train, for lack of better words.
If I could throw something out real quick, this is again Rick Donnelly. It sounds like a couple of folks went ahead and disconnected from their computer and used the phone to actually do the audio component, and they're saying that helped them with the connection. So I don't like interrupting Matthew, but I do want to make certain everybody is able to connect to the best of their ability. So try using the phone option as opposed to your computer option for audio, and hopefully that will improve the connection.
Thank you, Rick. We good? I'm going.
All right.
Okay, so again, things to kind of remember is that, when you're looking at these particular things, just a regular physician's prescription or script is not an assessment, and it's not going to be the sole determinant for medical necessity. Always remember that, it's about the individual's need and not the want of the parent or guardian or the provider. If the need, a lot of times, if a need is already being currently met with other resources and supports, then there's not a need for us to look at, for PDGS. I use the example is that if they already have a modified vehicle that allows them to access the community, then we're not going to support probably another vehicle modification being done if they already have a modified vehicle. If they already have an existing ramp in place that allows an egress in and out of a home, then more than likely we may not say that there's a need there. So again, what is the need? How's the need being met? Currently, what is triggering or prompting the request for PDGS? And always a lot of times is what is the functional capacity for using a requested piece of equipment or service? a lot of times, you know, the experience that I've had is that somebody wanted some type of nautical type of exercise equipment, and then what we come to find out is they were never really assessed to see if they could actually use that piece of equipment. And then, so the question is that did somebody actually sit down with somebody and try to assess what really their capacity was for meeting that outcome and using that piece of equipment? So again, PDGS cannot be a specialized service. You know, an example of this is to fund an attendee camper program that is only for persons with developmental disabilities. It's really prohibited by rule. And, you know, and unless the camp is providing both to the general population of both types, but if its only scope is for our population and they are not a certified provider, we cannot allow it to be funded through PDGS. There's a lot of things that go with that. You know, when they're a specialized service, you know, they basically, you know, they can request funding outside the allowable Medicaid rate of an existing benefit that's already afforded to the person. They circumvent our provider certification rules. They don't have to comply with MUI or client's rights, those types of things in regards to that, those safeguards that are necessary that are in place for our population. PDGS cannot be used to purchase items through assistive technology equipment. And this service was added at the beginning of January 19. So this includes, and it's not limited to, apps, sensors, video doorbells, other electronic smart items that are with there. So really, you know, and it's the same thing. If those things are in place, and I know we've had live chats about this, if you're questioning if this is truly assistive technology, we can link you up with the appropriate subject matter experts to have them review it to say, is this assistive tech or not? Medical necessity. So actually, you know, it's a fundamental concept underlying all our Medicaid-funded programs. So it's still got to be there. You still have to look at it. You still have to make sure that whatever's being requested falls within that scope. So this also goes in line with kind of like what DODD does in regards to simplifying this. You may recognize this if you're on Waiver for prior auth. You know, one, it's got to be appropriate for the individual's health and welfare, needs, living arrangement, circumstances, and expected outcome. It has to be appropriate type, amount, duration, scope, and intensity. It has to be the most efficient, effective, and lowest cost alternative that, when combined with non-waiver services, ensures health and welfare of the individual. It has to protect the individual from substantial harm expected to occur if the requested service, equipment, or supplies are not authorized. And one of the other pieces of this is it ties right into 5160 101, which is the general provisions of Medicaid. And some of those other things is it cannot be at the convenience of the caregiver or the provider. So it has to only be specific to that person and meeting their needs. So again, what is the responsibility for the county boards when they're looking at? You got, you know, the thing of it is PDGS enables people to engage in self-direction, but again, however, it's still subject to Medicare requirements, medical necessity, through the 5160 rule and 51232902. And then basically, like we said before, county boards should establish, if they haven't done so already, have an internal process for reviewing all these requests. This ensures consistent, uniform application of the rule in all circumstances, demonstrating the request meets the criteria for the authorization under the rule and within the scope of medical necessity. And this all should be done even prior to submitting any request to the FMS. So DOD does have out there, it's on our website, we actually have a nice packet of guidance that often at times, if you send something into the self box, either myself or Rick are going to send this guidance to you in regards to understanding the process, walking through the assessment, walking through the coordination of benefits for whatever is being requested, whether it be an item, a service, whatever that may be, that it walks you and helps you through doing that. There's also other tools that we've done or developed. One's termed the funnel, and then kind of you start real broad and it narrows it down to if it can actually be supported through the service.
All right, we're going to give Matt a break because he's been talking for about 30 minutes and he's moving really quickly. So just want to make certain he can save his voice for another part of this. So again, when we're talking about the county board's responsibility for those reviews, so again, individuals and families should receive a notice with information about the review process so they understand what the county board's process is of looking at these requests. So they understand the county board has a practice that it's done for all requests for all families, because sometimes I'm sure you've had an SSA say, well, so-and-so said that their SSA approved this, and then I'm now being asked for something that we as a team clearly don't believe the individual needs. So that's why it's incredibly important to understand, or it's incredibly important for the county board to have a process that's followed for all requests, and that your staff are very familiar with what that process is. So as part of that process, again, a clear statement that participant-directed goods and services is a Medicaid-funded service through a Medicaid-funded waiver. So the county board still has to be in compliance with those Medicaid requirements that include the need to demonstrate that the item or service is the least costly alternative to meet the need. We're not saying it has to be the cheapest, but we also they need to understand that it's not the sky's the limit, which I believe from the conversations that Matt and I have had over the last several years, that county boards work very hard to come to that conclusion when they're meeting with the families. It's just the families' understanding of what they believe the Medicaid waiver can do for them is sometimes a bit above what it really can do. So we realize county boards make a lot of effort around that, continue to make those efforts, and hopes at some point that the family will hear the message often enough, they'll buy into it and realize it's going to be that way. We know that probably won't happen for all families, but that consistency is pretty important. There is a time limit that the board established as a completion for these particular reviews, and they shouldn't exceed 90 days. So if the county board has set up a process of review, you need to keep that within a 90-day limit. This is pretty much what's in rule. And information about the ability to request a state hearing if the request is denied. So like any other waiver service under any of our waivers, if the county board decides to deny an item, then the county board does need to issue due process so that the individual realizes, or there supports that they can have an appeal through the State Board of Hearings to request the item, and you have to defend why you're denying it. All righty. So the department's review. So the rule that rolled out in 2018 contained new language about specific items that the department wanted sent to us before they even go to Morning Sun in a spending plan. So these are the items that have been identified. This was part of the original guidance that the department issued, but then later on we made part of the new rule. So pools, spas, trampolines, and play sets, appliances, fences, home modifications exceeding $10,000. So those are the items that we have. Services that may be duplicative of other services available through SELF. Now, Matthew's already touched on this a number of times. One of the things he was alluding to earlier when we're talking about specialized camps, like the camp that serves individuals who have autism, sometimes we have for individuals who have visual impairments or hearing impairments, because their target population are folks with developmental disabilities, per the rule, per the participant-directed goods and service, that's considered a specialized service and is prohibited from being authorized through participant-directed goods and services. So what you would be looking at is community respite, which is camp. When Matt was touching earlier upon some of the other services that exist, he was talking about the fact that some of these specialized camps, those providers, if the family wants to really go to that camp, that provider would need to become a DODD certified provider for community respite. He's included some other services here as far as sometimes supports that the person may need in their home and in their community. Those things could be met through participant-directed homemaker personal care. Again, we also have house early and periodic screening, diagnostic, and treatment, or EPSDT. That's a mouthful. I always forget that, so I'm glad Matt put that in the slide. Other known as health check. This is, again, for those folks that are 0 through the ages of 20. So for the individuals that are enrolled on this waiver, and there are a lot of kids that are enrolled on this particular waiver, there are these other services, and that's, again, when Matt was talking about looking at other payer sources, EPSDT is something that the county boards are supposed to pursue and will be something that we'll look at if something comes in as a request that we know potentially should have been submitted to Medicaid for review and was not, or the information that we get back doesn't clearly reference that EPSDT was looked at or ODM was involved in a review. So when you're submitting your request to the department for a review, we're going to ask the following items be included for it to be considered a complete request, because we want to try to turn these around as quickly as possible, because we realize that if it's something that can be approved, that needs to get to Morning Sun in a prompt and timely fashion so they can expedite the purchase of the item. We don't want anybody having to wait. So we're looking for documentation of the county board's internal review process for that particular request, and that it meets criteria as identified in 5123-9-45, which is the PDGS rule, And then again, 5160-101, which is Medicaid medical necessity. We're looking for those person-centered assessments that were conducted prior to the submission. So we're expecting that if you've come to the table with an item or a service, that you've had some form of assessment that would have identified the need for that specific service. Those things could include occupational therapy, physical therapy, or speech therapy. There are other types of assessments, so those aren't the only ones that are out there. We're looking for a copy of the person's current individual service plan, and that the plan captures what the actual need that will be addressed through the particular item or service that's being requested. So we would not expect to see that the individual is going to have needs throughout the course of the year that will be addressed through the purchase of either services or items through participant-directed goods and services, because that's a generic statement. We're looking for something very specific about, for example, that Rick needs a ramp added to the home because of his cerebral palsy. He doesn't have the ability to enter or exit his home in a safe manner based on the current steps that are in the home. And then also that the county board has reviewed the least costly alternative. In other words, whatever you're requesting, that you're showing us that you didn't necessarily, so the family is requesting a mod for a vehicle, and you come back and say, here are three bids, $20,000, $18,000, and $17,000, but they're all really for the same mod, when in reality there could be another modification that still meets the need that's a least costly alternative. So it's not just of the three bids that was the least costly, it's that the actual mod itself is the least costly alternative to meet that need, as opposed to all the bells and whistles that they might want. Okay, so requests that are submitted to the department within 45 days of the last day of the person's waiver span may not be resolved. So it is important to remember that after the end of the span, there isn't going to be the ability for a provider to bill for that service, because any service billed outside of the waiver year actually falls into the next waiver year. So that's why it's crucial to get these requests into the department within at least 45 days before the end of the span, so that we have an opportunity to review it, to be able to give feedback, so then that can be passed to the FMS to make the purchase. Because if it's something that requires payment upon delivery, and that delivery takes 60 days, then it's not going to occur within that year. It's going to occur in the next year. That's why we're asking, please, 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 as soon as you're aware of something, or at the very latest, no greater than 45 days before the end of the span. The department will issue a response regarding whether we're going to support the item or we're going to deny it. If it's denied, we will take care of issuing due process within 30 days of the receipt of all the documentation that was identified in the prior slide. So that's why it's really imperative. This is something that we put out there in guidance. It's something that's available. Please make certain you've got everything included before you send that request to us for review. And I think we've already covered. Okay, so yes, the last bullet point here I kind of already covered, where based upon our review, we believe that the item meets medical necessity, that it meets all the criteria identified within the participant-directed goods and services rule, that we'll go ahead and reply back to the county board that the item meets criteria and that the FMS has been CC'd on the email, so that they're aware at the same time the county is, that they can be moved forward to be requested. I'm going to do a real quick check here to see how people are doing. Okay, and again, as Matthew already mentioned, because we've got a lot of ground to cover, we'll try to capture questions at the end. We're able to get save a copy of all the questions that are asked, so we can actually reach out to people if we're not able to cover them before the end of the webinar broadcast itself. All right, so a little bit more about the review process. So upon review by the department, a decision is made that the item has been determined to meet medical necessity. However, DODD could not identify that all PDGS criteria were met. For example, the county board may not have demonstrated that the item was least costly to meet the identified need. DODD will identify what criteria has not been met and provide the county board an opportunity to submit that additional documentation to address the requirements. If, again, the county board continues to want the department to approve the county board's request. If the county board still fails to submit additional documentation, the department will notify the county board that it is the responsibility of the county board to ensure that the authorization is within criteria and meets all Medicaid requirements. And in the event of the audit, finding the county board may be responsible for Medicaid reimbursement if the identified criteria is not met. So sometimes, I'm sure some of you folks are out there, after Matt's completed his analysis, we may go ahead and say that things look good, but here are some things that weren't clearly supported by the documentation provided. We're not denying because of the fact that we believe that there's sufficient documentation to support, but we're letting you know that in the case of an audit, because not everything was there, that there could be a finding and a Medicaid payback. And obviously the last criteria that's here talks about the denial. So we do a review. We don't believe it meets authorization under, again, the PDGS rule, which is 5123-9-45, or medical necessity, then we will deny the request and we will issue due process to the individual. So again, those requests need to be submitted to the self-waiver@dodd.ohio.gov mailbox. That's pretty much been the mailbox that we've had since 2012. Yep. Matthew's looking at me like he's ready to jump back in.
No,
yes?
I think after this slide, we're going into employer authority, participant direction.
Okay. All righty. Oh, you know something? I am so sorry. When I saw 64 slides, I thought that was ours and not the FMS's portion. So that's my fault. I apologize, folks. Here I was telling Matthew to move it along, and it was one of those things where, my apologies, sir.
It's okay. You gave me the break. Like I said, the only thing is if there's questions about participant-directed goods and services, reach out to the self mailbox. And some of those items that, like I said, there's some things that are not required. And what Rick and I want to make sure that you guys understand is we're not the PDGS police. We're not policing every single thing that is being submitted or requested. If you want us to look at something, you want us to help assist, or the policy team to take a look at what's being requested, or is this something really that's doable, or if we just come out and say, you may not like our response because it may be no. But, with that understanding, we'll try to look at what's being requested to see if it fits within the service scope definition. There are some things in regards to our policy that we will not support through waiver funding. I'll put this out there, the things that because we have health and safety alerts out there, because it does put our population at risk, things like walk-in tubs. The reason why pools and hot tubs in regards to it puts our population at risk. We've issued health and safety alerts about that. When it comes to enclosed beds, some of those things, it's hard to assure that it does meet medical necessity because of the nature of the item in particular. So if there's questions about that and you have them, reach out to the self mailbox, and we can set up a conference call or we will respond through an email to you about what those are. It's still a process. It's still, again, PDGS is not, like I said, a lot of people want to fast track some things there, and sometimes the reality of it is it doesn't fit within the service scope definition. And it's a process. You have to assess. You have to look at the need. You have to have your supporting documentation there. There has to be a lower cost alternative looked at. You have to show some type of cost comparison process, or what if there's other resources that may do the same function or outcome, why those aren't being explored and looked at. Because actually when it comes to us, if it's one of those items, we're going to probe those questions to assure that what's being requested can meet that need of the person and it meets medical necessity.
All righty. So I wanted to talk a little bit about participant direction because of the simple fact that we still receive questions, which is fine, regarding the whole piece around budget authority and employer authority. And the employer authority piece, which I'll speak to in a couple of moments, will allow for a good segue into Morning Sun's presentation because they handle assisting the individual with either common law or co-employer. So one of the essential things about enrolling an individual on the self-waiver is looking at whether or not that individual, their family members, if they're a minor child, or sometimes we have individuals who have guardians who have been appointed to assist them in making decisions, or some other form of support, because not everybody has the luxury of having family involved in their life, are able to exercise participant direction. So participant direction within the self-waiver is composed of budget authority and employer authority. So with budget authority, it needs to be very clear when you're explaining to the family or the individual about enrollment potentially on the self, that what this means is that individual, and again, their supports, whether that's family or non-related folks that assist them, can look at allocating funding for specific services or items. So them saying, I want to spend, $3,000 on participant-directed homemaker personal care. But the important thing to remember, and this is one of the things that I think families struggle with understanding, is that funding for those specific services or items still have to meet the criteria based on the rule. So in other words, for participant-directed homemaker personal care, I've had family members reach out and say, hey, I want to pay this person who's a really good person who works with my son or daughter $30 an hour because that's the only way to keep them. Well, there's an established rate for all Medicaid services, and that's where the family can't, or the individual can't suddenly say, I want to pay them $30, but maybe the rate per hour is $19.54. I'm making up a number right now. So that's one of the things to kind of share with the individual and their supports, whether it be family or other folks, that yes, you have the ability to identify specific items or services that you want, but again, the cost for that item or that service still has to meet the definition of what the rule says around a specific service or item. And then as far as employer authority, again, this is where we have, there are specific services under the self-waiver that require that either the individual, or if they're a minor child, their parents, or whoever is serving in lieu of that adult in the family. So it could be grandma, grandpa, that could be an older sibling, that could be another family member, that could even be somebody who's non-related, has to be able to be responsible for identifying, recruiting, training, and supervising those staff who are going to be delivering those services to the individual who's enrolled on the waiver. So as far as the actual process, again, as Matt's already talked about, you're going to be doing the individual's ISP meeting. You're going to be identifying needs based upon assessments that you've conducted that say, here are the kind of things that we know Rick is going to need assistance with. So through that process, you're going to be looking at what those costs are going to look like. Because since this is a cost cap waiver, obviously we can't authorize more services and funding than there's a budget for there to be available. So the ISP process itself takes care of formalizing what those final services are going to look like. And then as the county board enters information into cost projection in the Medicaid services system, and you enroll the PAWS plan, the payment authorization of waiver services, each night at midnight there is a data documentation transfer between the Department of Developmental Disabilities and Morning Sun, our FMS, that provides them two sets of documents. One are all of the PAWS that have been enrolled that day that address participant-directed goods and services, or participant-directed homemaker personal care where employer authority has to be exercised, and the spending plans that are associated with those. So it is important, if you make a change or an update to somebody's authorization, make certain you do a new PAWS, which will trigger a new spending plan, because the FMS can't act on a request unless they have an updated spending plan that reflects either a new provider, a new service, or an increase in authorization of cost. And again, it is something that the individual obviously can receive from assistance from their family, from the SSA, from other team members, and a support broker where support brokers are part of the equation, because I don't believe we have quite a few support brokers, but not that many individuals enrolled on SELF are using support brokers on a day-to-day basis or for some of these other functions. All right, as far as employer authority, so again, the individual has the authority to recruit, hire, supervise, and direct staff who furnish supports. The individual functions as the common law employer or the co-employer of the staff. So again, I've already touched on the employer authority. Just wanted to, again, review common law versus co, because again, families sometimes struggle with what kind of responsibilities does that mean for my family member who's involved in the waiver, or for me because it's my child who's under the age of 18, or it's somebody who I'm guardianship for. So the individual and or their family says, we want to be the employer of record. We want to be the person that's involved in all aspects of what's going on with this person that's been hired to provide services. So in that particular case, again, the FMS, they'll talk a little bit more about that process in their part of the presentation about how they walk through taking care of those pieces for that individual and or their family. But the individual is the employer of record. As far as co-employer, this is where the individual says, hey, we're not certain that we really want those responsibilities. We want to be involved in training because we should. We want to be responsible for looking at potential recruitment and also the day-to-day supervision of those folks, but we really want somebody else that is going to be there if we have issues with the provider in question not providing services, not showing up, being difficult, not respecting our home when they're here. So that whole third party is, when it's with the FMS, we're talking about co-employer. But when we're talking about agency with choice, this is where the individual has chosen the co-employer model but has selected someone else other than the FMS to share that responsibility. Okay, so under common law, I think I've actually already covered this. Sorry, this is fairly straightforward. Most of this language is from the original self-waiver trainings that we did that were out there for quite a few years. So again, Common law, we just indicate the person or their family member as the employer record. Again, the FMS or the financial management service provider will take care of handling payroll and all other services related to that employee under co-employer or agency with choice. Again, the person participating in the service acts as the managing employer. Again, recruits, schedules, and manages workers, but the workers actually are employed by the agency. Sorry, I was looking at that thinking the words weren't coming through to me. I apologize. So again, in this case, when it's chosen as Morningside to be the co-employer, or even if it's agency with choice, that agency takes care of, again, payroll, employee-related functions, and workers. So the bottom line is, even if I choose common law versus code, the FMS is involved actively in supporting that individual and or supports for that employee. They're going to take care of payroll. They're going to take care of cutting checks. They're going to take care of issuing those W-2s to the employee at the end of the year. But there is an expectation that the individual and or the supports are actively involved in training, supervising, and providing feedback regarding performance. Okay. I think with that, we're ready to switch over to Rebecca and Cheryl.
Answer a couple questions? Or?
We are at about 10 minutes of. Would that be okay?
Yeah.
So, all right. Let's see what we've got. There's quite a few. So again, for those folks who came in a little bit later, we are going to make the PowerPoint available. We'll email it out to everybody who is registered for the webinar. One of the questions that was in early on had to deal with how do we ascertain that the family is not able to afford said item? Because this has been an ongoing question by the county boards. You know, we go to the family and say, hey, you know, are you sure you can't afford it? Are you sure you don't have private insurance? And the family says, no, we can't. We want the waiver to pay for it. The county boards have often said, well, how far do we ask the question? Do we ask for them to provide us a copy of their insurance policy? Do we ask them to provide us a copy of their wages in order for us to say that, oh, no, well, yeah, you can, because your insurance is right here that you can cover that. Or, you know, you're making $300,000 a year and you're asking us to spend $20,000 on a home mod, or you're asking us to buy a bike and you have 4 other kids and you've bought bikes for those kids. Why are you asking for the waiver to pay for this? I think, you know, the bottom line is that as long as whether or not you decide to capture it in the ISP or capture it in targeted case management notes, that you've had the conversation with the family, we're not asking you to demand that they provide you a copy of their insurance policies, that you demand that they provide you copies of their W-2s to show their income, because the family's not going to do that. They're going to tell you you have no right to ask that. But as the local Medicaid authority, you're sharing with them, we have a responsibility to only expend Medicaid funds for those things that Medicaid would be the payer source. We're not going to pay for things that you as a parent would buy your kid a bike, or pay for clothing to dress them in, or to buy food for them that you're buying food for the other kids in the home, and because you want to buy something different for Rick because Rick's on a waiver, that wouldn't be acceptable. So I think the department's comments have been over the years is that we just want to know that you had the conversation. You may decide as a local county board, based upon your relationship with that individual family, that there are maybe some things you can ask them that you can't ask all of your families. We just want to make certain that you've had the conversation with them, and so it's not just an automatic, the waiver's a payer source, or you're going to look at Medicaid state plan, but the family does have some responsibility if they have private insurance that will cover, or that they have the funds available, that is something that they would be involved in the process.
I mean, the reality of it is that's why it's about coordination of benefits. And a part of that is, it is part of the general provisions of Medicaid, those conversations have to occur. If there's a third-party payer source, specifically private insurance, it has to be vetted, it has to be looked at, and really, it may be, you know, how far do you take it? A lot of times you're going to use your own discretionary judgment to do so, but again, you as the local Medicaid authority have to be able to demonstrate how you determined the least costly, how you examined all resources, how you coordinated the benefits for these particular individuals. You know, and like what Rick kind of said is that there are, you know, again, it's to support, it's not to supplant, you know, those needs. It's not to, you know, negate parental responsibilities for custodial care of their children. You know, the expectation is, you know, it's not going to pay for food, it's not going to pay for the clothing, unless there's something specialized medically about those particular items that can be funded through Medicaid as a funding source. But again, you know, if there's private insurance available, that has to be vetted, that has to be looked at. There's a question about what form do you use, and like I said, a lot of county boards have come up with their own internal review process. They've developed their own forms, or they've worked with the Council of Government to go out and look at doing this, because it's similar in regards to what's being provided through Level 1 and IO for specialized medical equipment, or for environmental modifications for accessibility and adaptation. So those are the type of things that you have to take into consideration. You need a process in place. You need to go through, and there is guidance. I think one of the questions was, where's this guidance at on our website? If you do a search of participant-directed goods and services, it'll bring up kind of a format of the process of how you walk through it. There's also resources within our My Learning for the self-waiver specific to support brokerage, which also provides very informative information about PDGS and some of the self-waiver services that you can also kind of tag into and look at.
We have time for one more question. It's about what type of assessments do we believe, the department believe, you would expect to see with regards to vehicle modifications? And I think that, again, whether it's a home mod or it's something where you're modifying a vehicle for accessibility, in most cases, and Matthew, correct me if I'm wrong, usually we're looking at occupational therapy and physical therapy assessments. Because granted, while they're not mechanics, they're very familiar with a lot of the modifications that allow accessibility for vehicles in order to make it easier for the person to get in and out or to be transported. So I'm not certain that we're really looking for anything outside of what's typical, because they usually cover those things fully in scope.
So the one thing I can kind of to add about vehicle mods is that I was presented in regards to providing some guidance in regards to vehicle modifications to the field. It's going to likely be released in Memo Monday, hopefully this coming Monday, in regards to, it kind of gives insight in regards to look for the ins and outs, not just for PDGS, but also for within our other, for IO waiver services for specialized medical equipment. They kind of tax into certain things that kind of leads and provides guidance to you in regards to if there is a request, whether it be through PDGS or through specialized medical equipment for a vehicle modification. So yeah, the expectation is that you would have a subject matter expert, whether you want to call it an environmental engineer, because a lot of times you, as the team in the SSA, aren't necessarily the subject matter experts on that particular equipment, whether it be a vehicle mod or what's being requested. So sometimes you have to go to the vendor, you have to reach out, and you have to ask those questions and probe them. Again, somebody comes to you and lays it on your feet, I want this van mod for this 2017 Dodge Pacifica, I want this to be put in place, and it has all these bells and whistles. You as a county board have an obligation to go through that and try to determine what is really necessary for the person. And a lot of times the segue to that is, are you trying to modify a vehicle to allow the person to be an independent traveler, which means they can operate that modified vehicle themselves and are not dependent upon others to support them in transporting them into the community? So that kind of with the vehicle mods, I'm hoping to get that guidance out, to the field through Memo Monday. But it's going to be a good resource tool for you, not just with PDGS, but also with IO in helping and assisting with that.
All right. I think we're going to need to move over to financial management services as far as for those folks to go ahead and do their part. So we're just going to switch gears here for just a moment so that we can get them settled, so people will bear with us.
Good morning, everyone. My name is Rebecca Lapari with Morning Sun Financial Services. I just wanted to introduce us and talk a little bit about who we are. We're a Minnesota-based financial management service and fiscal employer agent with an office in downtown Columbus, where I'm located. We are serving people with disabilities and the elderly in many ways through many service types. Self-directed, we've been in the self-directed services in Minnesota since 1999, and we've been part of Morning Sun Financial Services since 2006. What is a financial management service? Administrative support. Supports self-directed service models and budgets, enrollment and services. We provide payroll and payments for goods and services. We provide budget management and accounting. We let you know what is spent, what's left in the budget, and end of the month budgeting reporting, which you guys should be receiving in your emails. And if you're not, please let me know. And we provide ongoing administrative information and support to participants, service support administrators, support brokers, and DODD. And what type of claims do we process? This is what we're going to be talking about, and there's 4 essential types: participant-directed, homemaker personal care, PDHPC, participant family disability assistance, SPS, support brokerage, SSU, and all participant-directed goods and services, PDSG.
Hi, my name is Cheryl Vennerstrom, and I'm the Chief Operating Officer for Morning Sun. I am based in Minnesota, although I am frequently in our Columbus office. And one of the things that we wanted to accomplish today was we want to talk about Morning Sun's processes, and we're grateful to DODD for inviting us today. We know that you may have questions, and we too want to follow up with questions that you may have later. And also, we understand that we've had some feedback that our processes are difficult, or people think things are taking too long, or have that experience that things are taking too long. And we want to reassure you that we want to communicate better and do more training and make sure that people are getting their needs met quickly and efficiently. And so please let us know what else, as time goes on, please let us know what else we can do to make this work better for everyone. And so I wanted to just talk for a minute about the common law employer model. And as Rick said, this is an employer authority. The basis for the common law employer model is that the participant or their representative is the employer. And that means that as part of the employer packet, there are forms that establish the person as the employer. And they're rather daunting to look at. They're IRS forms. And but one of the things that we want to do is help explain those as your financial management service. We want to explain those forms to participants and to SSAs so that everyone understands, why they're filling things out and what they're being used for. So there's another form that's in the packet that gives Morning Sun the authority to act as the payroll agent for the employer. And I think that although the forms that that people have to fill out to do this can be overwhelming, part of our role is to be an administrative assistant or administrative support to participants and to SSAs to make sure that people, get the support they need so that they can self-direct. Among the things that participants do is that they do all they make all the decisions about their employees and when they work and what their schedules are, and they approve the time worked for payment of the services. And what our role in all of that is really as the payroll, again, as the agent. We're the intermediary. We collect time and attendance data. We bill the state for the payroll. We issue pay to employees. We withhold and pay all the payroll taxes, and we create the reports that go to the IRS. And I think one of the things that we try to instill when we're talking to people who are the common law employers is, and their employees is, that the participant is the employer in this model and not Morning Sun. So we don't want to be mistaken as the employer, because really the control and the flexibility that this offers is about meeting the participant's needs. The co-employer model is also available under the self-waiver, and what's different about the co-employer model is that Morning Sun holds that employer identification number. We are the ones who, when the payroll taxes are paid and whatnot, those go under the Morning Sun, Morning Sun's employer identification number. And so that's why it's referred to as a dual employer or a joint employer relationship. And that is also why we talk about the employer liability being shared, because Morning Sun, although in the common law, under the common law employer model, we take on the liability for making tax payments. In the co-employer model, we actually assume we are entirely responsible for things like tax payments. There's some variations in these models between responsibility for labor law and for employees. And what we say under the co-employer model is that the participant or the representative is the managing employer. And so there's still responsibility as a managing employer. You still have a responsibility for your own conduct and how you treat employees and whether or not you're terminating them for cause. But again, there's just that dual relationship that exists under the co-employer model. We also, there are, the participant is assigned hours and scheduled in the same way under both models. And a lot of the functions that Morning Sun does, collects time and attendance, issues the pay, does the payroll taxes, those are common to both models. So as I'm sure you know, we have packets that people fill out when they when they start self-direction, and those packets we're not going to go through at this time, but we want to just talk about them for a minute. Once an employee is selected by the participant to provide services, the employee has, their separate packet that they fill out and they return to Morning Sun. Participants also have the employer packet to fill out and return. And although there are instructions in each of those packets, if you put the instructions next to the forms, you can go line by line through the forms. A lot of people find that overwhelming as well, and we understand that. And so we really encourage people to call us on the phone. And we encourage employers, employees to contact us. We can walk people through those packets and help them, and that really reduces the number of errors in the packets. Unfortunately, these packets, they go, as I said, to the IRS. So we collect information for employees that has to be processed, they're very specific, and I always say that we're very picky about the forms. And not because we like to be picky, but because we're required to be picky because of the nature of employment and IRS law. We want to mention payroll. All employees are required to complete timesheets to record time worked. these must be approved and signed by the employer. So we always require the employee and the employer's signatures. And timesheets must be an accurate reflection of time worked. So, you know, if somebody fills in timesheets and they don't, you know, they just write down 8 to 4, and they didn't actually work those those exact hours, that would be an issue that it didn't reflect the actual time worked unless they did actually work 8 to 4. But that's something else to be aware of. We also require task detail daily documentation sheet, and that is something that started about 1.5 years ago. That and we communicated with you all at that time and with the participants about how those documentation, that we had started to collect those documentation sheets. And now we're requiring those before we issue payment to people. So we, as part of our, we want to get out the email. People can email forms to us. They can fax forms to us. We do have a web-based portal. People can request forms from our office. We can pre-fill forms. People can go to our website and print forms from online. We recommend that people either ask us for forms or ask us to mail the forms or send them through email, but that you get new forms from us, because forms are updated from time to time, and we don't want a lot of old forms or outdated forms to be circulating out in the world. And then people can paper mail forms to us, although it does, when people mail documents to Minnesota, it takes about 4 days. So that's, I guess that we call that the least efficient way to get forms to us. They can, people can bring the forms or mail the forms, however, to our Columbus office, and then we will process them and send them by email to the Minnesota office. Paydays, we pay on the 15th and last day of the month, and people have choices about, the employees have choices about how they want to receive their pay, whether they use direct deposit to their checking or savings account. They can use a pay card and sign up for a pay card with us, which is like direct deposit. If we mail a paper check, again, that's for about a 4-day mailing time period. And he's, as I said, we can paper mail or pre-fill packets. We need to know which packets. There's been we've had some experienced confusion since we started, self-direction became available with the IO and the level 1 waivers. We've also, we need to know whether people want to use the common law model or the co-employer model before we send the forms. And if you do want us to pre-fill packets for people, which is really a nice option, because then they don't have to repeatedly put in their, you know, their address, phone number, email, and all that information over and over again, and it makes I think it makes the process of completing the forms go a lot smoother. But here, the employee and employer information that we need is listed on the slide. So, and then the last thing, I guess, that I wanted to say is that about the hiring is that when we say Morning Sun issues the start date, that is something that I think has led to some confusion, because there are some things that we are checking for that, and what we mean when we say Morning Sun issues the start date is we are going to tell you when everything's done on our end. When all those packets have been processed, all the forms within the packets have been processed, when we know that the employee has been certified to provide these services, when we've received a spending plan through MSS and PAWS, all those things have to happen before the person is eligible to be paid under the waiver and by Morning Sun. And so when we say that any time work prior to the start date provided by Morning Sun will be unpaid, we mean we haven't finished all our processes prior to that start date. And so if the employee started working, we wouldn't be able to pay them because we can't bill for that time and process those claims. And so again, if we want people to call us, we want to be able to help make these processes go more smoothly. We're always available to answer questions, and we've started a process where we're looking at our workflows and looking every week or two to make sure that we don't have people who have been in the system or been in process for too long, and reaching out and to see if they need additional help.
We also wanted to touch base on some issues that may delay payroll, because we know that, everybody wants to be paid after they provide services. Timesheets that are not completed properly or accurately, a lot of times they're missing things like AM and PM indications, so we don't really know if that's midnight and needs to go on to the next day, things like that. Timesheets are missing a signature from either the employer or the employee. Without that employer or employee signature, we can't process payroll because we don't have the approval that time was completed. Signatures are dated too early. So if we have a timesheet that's October 1st through the 15th, and there was time claimed on the 15th, but they were assigned for predated for October 8th, that means to us that the employer and the employee didn't approve that time that was worked after the 8th. So we need that adjusted. And provider did not recertify timely. So if the provider contract dates are not recertified, if there's a gap, we can't pay for the gap of certification. Now, if we receive certification dates and that gap is closed, and we will go ahead and process those pending timesheets for payment. It's just any time that there is a gap in certification for the provider, we won't be able to bill for. Driver's license or vehicle insurance is expired. Now, it's important that the employee keeps this updated with our offices, because if mileage is being claimed, we need to know that driver's license and vehicle insurance is valid. Issues that may delay payroll continued. More than one timesheet was turned in for the same employee and employer relationship with different claims. So if we receive an October 1st through 15th timesheet and every day is claimed, and then 2 days later we receive another timesheet where they only claim the 15th, that makes us think that they made a mistake and they didn't actually work the 1st to the 14th, and they're only now claiming the 15th. So if they forgot to add a second shift on the 15th, all claims need to be turned in together on one specific timesheet. They can't just add time to that later on without sending us all claims. Timesheets are received after the due date. That's fine if that happens. We actually provide a courtesy late pay day, which is scheduled always 2 business days after pay date. And as long as there's no issues with those specific timesheets, we'll go ahead and pay those on late pay day. Now, if timesheets are turned in very late or after payroll, that won't be paid until the payroll that's scheduled the next time. If there's insufficient funding left on the budget allocation, a lot of times we see this at the break of fiscal years, where they've just run through the amount of hours and funds that were available to them. So we will either reach out to the family, the employer, or the SSA to say, hey, is there any funds that could be added to be able to pay this timesheet, or are we unable to pay it at this point? Is this service not going to be approved? Issues that also may delay payroll: continued overtime. We're able to pay overtime if the county approves the overtime in writing. All we require is an email from either the SSA or somebody at the county board saying, hey, this specific work week, we're approving this many hours for that employee to work over 40. Timesheets that reflect over 40 hours in a work week, that work week is Sunday through Saturday. And that's regardless how it falls on the timesheet. So I know that we pay timesheets the 1st to the 15th, and then the 16th to the end of the month. But sometimes a work week falls between both those timesheets, and that's really where the confusion lies with the employee and the employer, that, you know, it might be the 14th and carried on to the next timesheet is their work week, and they're like, well, I didn't really work 40 hours. Well, yes, you did, because the work week is really Sunday through Saturday, regardless of how it falls. And then any overtime that's claimed through one employer will require the county written approval. So it's not necessarily I worked 40 hours, over 40 hours between two separate participants. It's when I work over 40 hours with one specific participant would be our considered overtime that we needed approved. More about payroll. Like I talked about before, we have a courtesy late payday, 2 business days after scheduled payday, and this is when we must have corrected issues on the timesheet. So if somebody has an issue on their timesheet and they don't get it to us before the scheduled regular payday, we'll go ahead and try, if they get it to us between payday and late payroll day, we'll try to get them on that late payroll so they don't have to wait for payment on the next payroll that's scheduled, 2 weeks later. We want to get them paid as soon as we possibly can. We don't want people to have to wait for their paycheck. But again, timesheets that are corrected later than that, we will have to pay them on the following scheduled payroll. More about payroll. Understanding the difference between cost to budget and gross hourly wage, employee wage. The cost to budget is the amount charged to the plan, which includes wage and employer taxes. Gross hourly wage is the amount paid to an employee prior to employee income tax withheld. So let's talk about that as if you were to pay the employee the maximum right now. The maximum that's going to cost to budget is $17.96. But really, the employee's gross hourly wage is $15.89. That difference is 13%. That 13% does not go to Morning Sun for our pocket. It goes to employer taxes that we take on at the role of paying. Morning Sun is paid through a contract separate, so the budget for the participant isn't affected by Morning Sun being involved. So then employees ask, okay, well, I'm making $15.89, but really that's not what I see on my paycheck. They see the $15.89, but because they're a W-2 employee, their net is less than that based on how they fill out their payroll tax forms that are included in their packet. And then the participant homemaker care, HPC, what we were talking about, it's up to $17.96 per hour, and that's the cost to budget. That's before employer and employee taxes are withheld. The hourly wage paid to employee can be negotiated up to the $15.89. Employer payroll taxes are 13%, like we spoke about, and remember, please, that employee taxes will come out of that gross hourly wage. It all starts with a participant spending plan via MSS and PAWS. The plan is established by the participant, the service support administrator, and or support broker. Once this is completed through MSS and PAWS, the plan is forwarded electronically to Morning Sun. So I know some counties have it where there's a fiscal department that enters the pause portion. So sometimes there's a delay between you entering in the information, it going to fiscal, and then coming to Morning Sun. We're just waiting on that key piece of pause being updated before we'll receive that plan. You're always welcome to reach out to us and ask us if we've received a plan, if you wanted to see what they look like. They're very, very similar to how they were a few years ago when you sent them to us yourselves as SSAs. It still looks like kind of like an Excel spreadsheet. But if you ever wanted to see one, you're more than welcome to email me. I'd be happy to provide you a specific participant in your county. What if the spending plan changes? Morning Sun must receive an updated, revised spending plan if budget amounts change, our new services or personnel are provided. So if you have a new goods and service item that you want to add, or a new person through HPC, participant-directed HPC, we need to see that on the spending plan before we can make any payments or start the hiring process. And we ask that no changes less than 30 days before the end of span year. We understand that's not always, some things do happen where, you know, we need this now, and that's okay if that happens. But if you could just send me like an email that says, hey, Rebecca, I know that the span is ending, but we really need this item now. Is there any way we can get this pushed through? I'd be happy to try to go ahead and do that, but we need the things that we'll talk about in the next slide prior to getting the item changed. But I will try to push the item through our budgets and purchasing department as soon as we possibly can. We want to be able to provide those services to you, but because it's so closely on the span, we won't always be able to do that for you. What if claims don't match the existing spending plan? Morning Sun will contact the SSA or county board for follow-up and guidance. So if the vendor is listed as Morning Sun instead of Amazon, we're going to have to reach out to you and ask you to change that because we don't have your specific approval to purchase from Amazon if they are not the listed vendor. That spending plan is what Morning Sun treats as the county's approval to go ahead and make payment. Also, purchases of goods and services and payments to employees will be put on hold until claims in the spending plan match. Like again, because we don't have your specific approval, if it doesn't match, we can't make those purchases or pay the provider if they've gone over budget. Roles of support brokers. So brokers advocate for the participant. They can be paid or unpaid, assist employer-employee paperwork, assisting with hiring, training, supervising employees, research and price out appropriate goods and services for the participant. But please note that legal guardians cannot be paid support brokers. We do get that question quite often. We don't have very many paid support brokers that are being used at the time. Most of them are natural support. But if you ever have questions about how to get that set up with us, you're more than welcome to either give me a call or shoot me an email. We'd be happy to help you with that process. Role of support brokers. Support broker is only needed if a person does not have natural support to assist with participant direction, or if they are not able to exercise participant direction independently. We also like to provide the link just in case you would like access to the COGS monthly training.
Just, you know, I'm sorry, I'm going to interrupt. This is Rick Donnelly. So support brokers training is now done online only through the My Learning portion of the DODD.ohio.gov webpage. We launched that last year. It's okay. It's one of those things that may not have been clearly communicated to everybody, but we decided that it was a lot easier for folks so that people didn't have to travel any distance to a particular region where that COG may have been providing the training, that online made it possible for anybody to take the training at whatever point in time they wanted to. So yeah, right now, I mean, the process is it's all online, but you don't have to worry about that. So what we'll do is we'll see about getting you an updated link so you can have that if you want to be able to provide that to folks.
I apologize for that. Thank you so much, Rick.
Oh, you don't need to apologize, trust me.
Okay. Participant-directed goods and services. Morning Sun's able to provide this service only for self-waivers. It's the most unique part of the model. It allows participants to customize their waiver services. It allows participants to purchase items or services that assist them to meet their goals or needs. The objective is greater independence and reduced reliance on paid support over time. SSAs have the authority to approve or deny goods and services requests. The county is the authorizing authority. And I just want to touch base on that. A lot of times we have questions about Morning Sun. I get emails or phone calls. Is this item approved for Morning Sun to pay for? Morning Sun, really, we can't approve or deny services. We don't have access to any of the information about the participant to know whether or not it's an appropriate purchase or not. So I would actually send you an email providing that goods and services guide from DODD from October 2018 and provide the self-waiver email if you were concerned about something like an audit. I also provided the list of items that require DODD review. I know that Matt and Rick both went over this: pools, spas, trampolines, play sets, appliances, fences, home modifications over 10,000, and services that might duplicate. So I won't spend too much time on that. All we really need is to see, the self-waivers response about the review to be able to move forward with payment. We can't move forward with payment without that. Goods and services, DODD review. These requests are sent from the county to the self-waiver email. I provided that email for you. You may copy a member from Morning Sun. It's fine if it's me, Sarah, Kim. When you put in the request to DODD, that way we can just save that with the request for the item in our documents. And like I said, to move forward with payment, Morning Sun needs to see DODD's response about being able to move forward with payment. Assistive technology, I just wanted to provide this rule change was of January 1st, 2019. These specific items that are requested through Morning Sun anymore, it's through a different rule. I just like to provide this information to the counties when we do trainings like this. If you have other questions, you're more than welcome to shoot me an email about assistive technology. It's not a problem. Goods and services, how claims are received. We receive them via secured email, via fax, and via paper mail. All of those are completely fine. And later on, you'll see the contact information for those specific items. Payments of goods and services, how we actually pay the vendor. We'll either provide a paper check or direct deposit. Sometimes they're asked if we will leave a credit card on file with a vendor. We can't. We can't do that. That's because we need your approval to make payment. So if they're just taking money off the credit card, we don't necessarily have your approval for October or November or December payment. So that's why we're not able to leave a credit card on file, is because we don't necessarily have your approval to make those payments yet. So we don't want that to happen without your specific county approval for those payments to be made. Payments of goods and services, what's required for claims to be paid. An invoice with contact information for the vendor. Participant identifying information. A lot of times we receive invoices and we don't know who it's for because there's no participant DODD number or participant name on it. Sometimes it'll come with mom or dad's name on it, and they might have a different last name, so we don't know who they are connected to be able to pay the invoice because it's not somebody we have on file. So it's really important for their name to be on that invoice or DODD IC number. Even if it's just handwritten in the corner, that's completely fine. If the SSA handwrites it in the corner and sends it to us, that we will accept that. It's just important that we know so we can go ahead and make those payments in a timely fashion. And are the goods and services identified on the spending plan via MSS and PAWS? We need to know the vendor, the cost, the date span that this particular service or good is approved for us to pay. Web links. You can provide the web links on the spending plan in the description or in the vendor. We will accept it that way, or you can provide that in a specific email to Kim, Sarah, I, or the actual purchasing department main email. Also, it's always great if you can provide the descriptions of the items if there's options. This can be provided in the description again on the spending plan, or you can send it to us in email separately. Really important is size, color, quantity, things like that, because if we don't know that information, it's just going to slow down the process of these items being purchased, because we're going to have to be sending those emails to the SSA saying, okay, did you want it in blue or yellow, and did you want it large? Is it, things like that. Issues that delay goods and service purchases. Actual cost is more than the amount listed on the spending plan. It's important to plan for sales tax and shipping costs. We don't have to pay sales tax if we have a prescription for the item, but in general, it's good to leave a cushion if you are able to, especially for things like Amazon where their prices change daily. So it might be $10 when you put it on the spending plan, but the next day it's going to be $15, and we can't make that purchase because we don't have your approval yet for that $5 extra. The amount on the invoice does not match the amounts listed on the spending plan. So if we have a spending plan from you approving at $500 and the invoice is for $1,000, we can't partially pay an invoice. Because we don't have your approval for the $1,000, we can't pay any of it until it's fixed. And then service dates on the invoice do not match the fiscal year listed on the spending plan. So if the service is approved on the spending plan through June 30th, and the service was provided on the invoice July 5th, we don't have your approval to pay for that service because it's not listed on the second half of the fiscal break. Goods and services issues that we run into continued. Vendor is not specified on the spending plan. In MSS and PAWS, a lot of times we get them and Morning Sun's listed, and we aren't, I know we're making the payment, but we aren't the specific vendor. Links for online purchases to specific items were not provided. Like I said before, please either put it on the spending plan or just send us an email with the link. We're happy to accept them that way. Items listed on the wrong side of the fiscal year. So we have to go based on the date of the items that is the date that it's purchased if we're ordering something from, say, like Amazon. So if we're ordering it July 5th, it needs to be on the second half of the split. And again, options such as size, color, quantity are not provided. Monthly expense summaries. Expense summaries are lists of actual expenses made through the previous month. Reports provide how the funds are budgeted for the year, so what's listed specifically on the spending plan, how the funds have been spent year to date, so the dates that the provider are working or when we purchase the item and how much it costs, and how much is remaining. So if you gave us $25 to purchase, I don't know, something like magnetic shoelaces, but the total cost was only $15, it's going to show you gave us $25, we spent $15, $10 are left over. And if you ever have questions on how to read those specific reports, you're always welcome to give us a call. I'm happy to go through the report with you, not a problem. Written instructions on how to read the expense summaries are provided in every copy that is sent out. Summaries are sent to the participant, the SSA, and DODD. So some DODD changes as of February 2018. Community inclusion was replaced with homemaker personal care. The maximum cost to budget rate is now $17.96 per hour. However, the rate still can be negotiated. So the family has the option, or the participant has the option, to pay the provider from minimum wage up to that maximum.
If I could. So for a lot of the folks that are tuning in today, they realize that as of January 1st, there's another rate increase that's occurring with participant homemaker personal care. I only wanted to mention that just so that folks, I didn't know that was part of one of your next slides, or you're just talking about the rate increase that occurred back in 2018. So as many folks, again, as I said, are aware, the rate increase for PDHPC has already been entered into the Medicaid Services System application. So one of the things that county boards would be doing for those people's waiver spans that cross the old rate versus the new rate that will start January 1st is those details will need to be updated in cost projections so that new pause enrollment will occur to identify additional dollars, and a new spending plan will be generated so the FMS can appropriately reimburse providers, those employees of either the individual and or the FMS for the new rate, once that rate has been negotiated. So just keep in mind that these were the prior rates. There are new rates that are available in the system, and information regarding those new rates went out in Memo Monday roughly about a month ago. Just wanted to mention that one change.
Again, and to continue on with that, Morning Sun's happy to make those changes, but we also are going to require a rate form that will need to be signed by the employer. That rate form is going to list the actual rate of pay per hour, not the cost to budget. So I know the cost of budget is going up, but the rate per pay per hour will be 13% below that. And if you need, I'd be happy to make those calculations for you. Just let me know if you're going to pay the maximum or not. We're happy to help you with that. We will have a new how much I can pay form for the employers with the updated grid that hasn't been provided yet, but that will be provided very soon. And another change that happened was STI will change from negotiated rate to a flat rate, which is mileage, and now the code is STN, and the mileage amount is 45 cents per mile at a 1-to-1 ratio. DODD changes February 2018 continued. Add-ons are new for our programs to our possible at the discretion of the participant. County medical, 12 cents per unit, behavioral at 63 cents per unit. Those are just marked on the spending plan. That's all we need to see as when we're supposed to be adding those, and they need to be removed when we're not supposed to be paying them anymore, and we'll adjust the provider's pay accordingly. Longevity add-ons do not apply to participant-directed HPC. I get that question quite a bit in an email. We are unable to process that. They don't qualify for participant direction. Morning Sun Financial Services now can serve IO and Level 1. The FMS option is now available. A few reasons why this option might be attractive to the family, the participant, or the employee. Family can negotiate the rate, so they don't have to pay that maximum. Dollars might be able to spread a little bit further. Family can dedicate training or dictate training requirements. So there's 3 requirements that the family can decide that they're not going to require of the provider, but if they do that, they have to use the common law model. And those 3 things are the diploma, the 8-hour DODD training, and first aid and CPR. And there are providers may want taxes taken out of their paychecks. We have seen that a lot of providers that were going through us already with the self-waiver, they really like it that they're W-2 employees. So they've talked to the families about on their IO and Level 1 participants that they work for to maybe possibly move over because it's really helpful for them to have their taxes taken out, and that's how a lot of the word has come across for Morning Sun to have IOs and level ones, is because the employees actually like having their taxes removed. And there's workers' compensation coverage provided. So part of that 13% difference is workers' compensation that's paid as an employer tax. So there's coverage there. Like I said, common law is the only model for IO and level one. And if a self-waiver decides to change those family-dictated training requirements, they only have the choice of common law. Participant and family member is the employer of record in this model. Customer service excellence is our mission. Morning Sun strives to provide excellent customer service at all times. We are committed to addressing concerns and questions fully and completely. We return calls and emails within the 24 business hours and assisting with completion of all necessary forms. And that necessary forms, we really would like people to call us. It is not a bother for them to call us to fill out forms. It's actually, we really want to encourage it because it really makes the process so much easier for, I believe, everyone, because they know right then and there that those forms are filled out correctly the first time. They don't have to worry about Morning Sun coming back and saying, hey, this needs to be adjusted, or hey, that needs to be adjusted. And it takes a lot less time for the forms to be filled out, because I can say, hey, line number 2, put, this is where your name needs to go. At the bottom, please make sure you sign and date. Things like that. It's step by step. And if we're able to provide a pre-filled packet ahead of time, if that's requested, an employer or employee packet takes less than about 10 minutes over the phone to fill out, rather than somebody trying to figure it out on their own, and it might take quite a bit longer than that because they've never seen these types of forms before and they're not sure how to fill them out. So it's really important. So please go ahead and give us a call. We want to help with that to make it so an easy process for everyone. We never want to be a hindrance. We want to be a support system as well. And then I also provided a slide with all of our contact information, our email addresses and phone numbers. Please don't hesitate to give us a call if you have questions, or email us if you have questions or concerns, or something's going on that you want us to look into. That's what we're here for. And you're welcome to give our contact information out to families. I get that question quite a lot, where SSAs aren't sure if it's okay to give out my phone number, my email. We encourage it. Please do that. Please feel comfortable giving that out. I want them to be able to give us a call because that's what we're here for. We're here to help. So, and I really appreciate everybody's time coming out and listening to our slideshows today.
Okay, do you want to see if there's some questions that you might want to answer?
Sure.
Let me do this. I'm so sorry, Sharon. What we got here? No, you stay, because the questions could be for you.
Okay.
My apologies.
Okay.
I'm just trying to see what they might have asked.
Okay. At 10.
Yes. Sorry, folks, we're trying to look back through to see what questions were asked during the course of the FMS's presentation. Here we go. Okay. Here we go. So, sorry, our cursor keeps disappearing, so every time I move it off of a document, I can't find it again to forward down. So it says, so one of the first questions is, does the SSA need to receive a monthly budget report? If so, who is responsible to get that report?
Okay, so yes, we do send out monthly reports to the county board. So if your SSAs aren't receiving the budget report, either an old employee is getting it, that it hasn't been updated with us for the new SSA to get it, or your fiscal department's getting it because they have the SSA listed on the spending plan because they're the person that enters the pod. So it's really important that you guys are receiving that information, because that way you know what is on the spending plan, what's been ordered, and what possibly hasn't been ordered. So you can question and say, hey, why hasn't this been, updated and submitted? Maybe we're missing something that we've been asking for and the communication's lost, or we're reaching out to somebody that's not working for the county board anymore and we don't know it. So it's really important that you guys are getting those reports so you know actively what's happening each month. So the county board should be getting it, the SSA the participant should be getting it, and as well as DODD gets it.
If family chooses an independent provider, can an employer authority be co-employer? So if it's, I think I can answer that one. So the bottom line is that employer authority is only going to be exercised over what we at the department and the county boards are independent providers. They're not going to exercise employer authority over an agency that may be selected. So, Rick Donnelly is an independent provider of homemaker personal care. He's certified by the Department of Developmental Disabilities as an HPC, PDHPC provider. Matt Turner is enrolled on a self-waiver. Matt and his family select Rick as the person they want to provide PDHPC. So Matt is enrolled on self, so the only option, Matt has to decide whether he's going to be the employer of record, which is common law, in which case the FMS is still involved because they're still going to issue payment to Rick's, when Rick turns in his time cards for hours he provided to Matt. It's just Matt's responsibility. It looks a little bit differently under common law that if Matt's family says, look, we really don't want to employ Rick directly, can you guys help us with that? In which case, co-employer is elected by the family. The FMS, again, will take care of processing those timesheets, issuing Rick payment, and those other things. So typically, it's only with independent providers that they become an employee under Participant Directed Homemaker Personal Care, under self, and as is also true under IO Level 1, when that is a service selected. Go ahead, Cheryl.
I think that and I had this conversation, somebody called me yesterday when I was in the Columbus office about this issue, and that is people aren't independent providers anymore. They're not 1099 providers anymore when they work for an employer or when either under the co-employer or the common law model. They become an employee, a W-2 employee, and so there's no way to waive that. They can't, again, they can't waive that authority. That's right.
I think the confusion sometimes, Cheryl, is the fact that they may have somebody who's an independent provider who's delivering homemaker personal care, where they are an independent contractor, and then they go to serve somebody on self, where now they're an employee.
Right.
I think sometimes that's where the biggest level of confusion is how is it really different? Well, it's different because of the service that you're providing to the waiver recipient.
Right.
Because we can't say anymore it's the waiver type because PDHPC is available under all three of our waivers. So it's about the service that's being provided that requires employer authority to be exercised either by the individual or in conjunction with the
It's about the self-direction option.
Correct.
And then there's still the requirement of those packets to be completed.
Right.
Correct.
Even if you're now just coming on board to be PDHPC or say that particular participant, they're still going to be required. They've already been certified through us as an independent provider or contractor per se, but they still, once that relationship has changed for PDHPC, there's that requirement for those packets to be completed.
Okay, so the next question, does EBV apply to self-waivers? So at this point, it does not. The conversations have started with the Department of Medicaid, with the Department of Developmental Disabilities about EBV coming into play because participant homemaker personal care is billed in a 15-minute unit, and under IO and Level 1, homemaker personal care, when billed in a 15-minute unit, is subject to EBV. So there will be information that will be made available to the county boards through Memo Monday about when that will occur well in advance of when it occurs, because how it will affect those call-ins that have to be done and the FMS in processing that payroll and those time cards that are submitted. If an individual lives with their provider, are the wages earned by the provider tax exempt under IRS 2014-07 rule difficulty of care?
Yeah.
All right.
Yeah.
You're back off mute, sorry.
Okay. So, this is a great question. If an individual lives with their provider, and if it's common law model, they do qualify for the 2014-07 rule difficulty of care exemption. There is a form in the packet for the employee that they would fill out that would answer those two questions. And then there's three options below on that form. One says, yes, I want the taxes withheld, or no, I don't want the taxes withheld based on the answers above. So there is specific, and that would be state and federal in the state of Ohio, exemptions regarding that 2014-07 rule.
Yes. The other thing that I would add about that is that is the employee and employer's responsibility to make those, the employee's responsibility in terms of the tax exemption. And, but Morning Sun doesn't have any responsibility to police them. So if the living circumstances changed, it would be the employee and employer's responsibility to report that change so that the tax status would change.
Okay, so the next question we've already answered. So if the waiver is self-directed and the individual is the employer and have scheduling authority, then why does the county board have to approve overtime? That doesn't seem like it should be our job. We can't deny overtime for anyone unless it goes, let's see the rest of the question. I mean, maybe it's on the next line. Unless, oh, good grief, I clicked the wrong one, I think. Sorry, folks, this is the technical difficulty piece. Back this way. No, go right ahead.
Okay, so I would like to start talking about that while we're looking up the rest of that question. Okay, so any time over 40, we have to pay at time and a half. So that's really what we're looking for approval for, to be able to pay the provider at time and a half. We need the county board's approval to go ahead and make those payments.
The other piece of that they're talking to, so even though the waiver is self-directed, and even though the individual can select a provider, that they've employed to provide services to them, there is a rule. It's basically the overtime rule that went into effect when overtime became an option for either independent providers of home or personal care or employees who obviously through participant-directed home or personal care provide services. So the county boards can't approve anything over 60 without meeting criteria that's listed in the overtime rule. That's why even though this is participant-directed, they can select providers. You as the local Medicaid authority still have a responsibility to ensure that Medicaid services are being authorized within scope of what rules allow for. So that's the only reason why there's still an involvement at the local level by the county board to look at what that employee is providing and whether it is exceeding 60 hours, and if so, does it meet criteria? Because there is a potential for Medicaid payback. In that particular case, that would potentially come back to the county board since you're the ones that approved those hours over 60. And again, there's language and rule. If you have questions regarding that, please send those questions to the self-waiver at dodd.ohio.gov mailbox, or you're welcome to reach out to myself or Matthew. We can have a conversation about what is in the rule with regard to in excess of 60 hours. And the mouse has disappeared again. There you go. All right, so we have time for one more question, folks. Okay, Matt, this is going to be one for you, I think. It says, does the self-waiver pay for the coverage of a rental car while a vehicle is being modified? Modifications are being paid through participant-directed goods and services.
Okay, so this has been a kind of a new kind of ask for us to take a look and review at. We have allowed and supported county boards in regards to authorizing, if a modified vehicle is being repaired, to authorize rental for a modified vehicle, not just for a rental car, because it still has to be specific about the person's condition and meet medical necessity. So in some cases, we have allowed for funding to be supported through PDGS for a rental of a modified vehicle in lieu of if a vehicle is being repaired, or if it's allowed to transport the individual in a safe, secure manner while they're still in their wheelchair, and those type of things. And so we would look at that. If there's questions that it's been, some of them I've answered, and they've been kind of vetted through the FMS and kind of asked, hey, can you take a look at this? But I think in general, if it is just a rental car that has no specific modifications or anything to it that's specific to a condition to transport an individual, the answer would probably be no. But if it is modified specific to a person's condition in regards to wheelchair accessibility, to allow a person to be transported, like I said, depending on the circumstance or the condition of what's going on with that individual, we would want to look at that. You would need to identify that within the ISP. The other nuances with that is that PDGS will not fund the insurance, gas, fuel, anything in regards to liability. That has to be whoever is choosing to rent that. That is going to be the obligation of whoever is named that particular rental is in. So that's not something that would be supported through PDGS, for example, covering the insurance coverage, liability coverage, those types of things, fuel, etc.
Okay, so we don't have any more time for any other questions, but as we mentioned earlier, we have the ability to print out all the questions that were asked during the course of the webinar broadcast, and we'll sort those out to those that are Matt and mine at the department and those that Rebecca and Cheryl will be willing to respond to. We want to thank everybody for their participation. I just want to check, do we have any other closing comments we want to make?
No, the only thing I can add is I want to thank the FMS for participating in today with our webinar. We're going to look and work hard to provide better communication and education to the field about certain aspects of the self, specifically in regard to PDHPC and PDGS, and that we really strongly encourage you to reach out to the department if you have questions or concerns. We want to alleviate communication breakdown and some of the issues that have been brought to our attention. So, like I said, if you have a question, reach out. We can do the best that we can in regards to answer that. If it's a policy question, myself or Rick will look at that and address that with other team members if it has to be within our area. But, again, it's a question. Reach out, ask the questions, and we'll do the best that we can to try to help support the county in their decisions in regards to what they're trying to do.
I think the FMS had a couple of comments I wanted to make, so
yep.
Go right ahead, please.
The only comment I just had is we are doing a county-by-county training. Again, if you request that in our offices, please give me a call or give me an email. I will come out to your county and give a presentation pretty close to what this was, but it's always, sometimes helpful for us to come out and speak to all the FSAs, things like that. We're happy to schedule that anytime. I'll come to a training maybe that you have scheduled already. Just let me know, and we'd be happy to go ahead and support that and come and for a visit.
And this is Cheryl. I just want to make one last comment, and that is, if you aren't getting your problem solved, and if for any reason you'd like my involvement, please feel free to contact me as well.
Alrighty, with that, we're going to wish everybody a good afternoon, a good rest of your week, and again, thank you for participating in the webinar.